Good morning, everybody. Today, my topic of discussion is fat dissolving injections and its collateral analysis as compared to other modalities available in the market for fat dissolving. Since a very long time, fat is our friend, and we know fat is around us since late 80s and late 90s. So now eventually since 2000s, fat has turned itself into an epidemic. Obesity is now, it's like a tsunami which has taken over the world by its horrific outcomes. And science and research has been trying a lot to give us solutions regarding the fat deposition and how to move fat and transport fat out of the human body. Frankly speaking, when I thought of having this idea of opening a aesthetic clinic, I never thought, and this was never in my mind, that fat dissolving and fat presentation and obesity presentation in my clinic will be in such a large number that I will have to give a proper solution to all my clients. When you have so much presentation of people coming to you with obesity, and my experience about the fat, it started long way back when I was working as a gynecologist and infertility specialist. In those days, and actually till today, I am on my toes trying to ask my clients suffering from polycystic ovarian syndrome to suffering from lower or smaller eggs, and all the girls and women suffering from polycystic ovarian syndrome and many other hormonal issues which are diagnosed under this diagnosis of hormonal imbalance. So for any woman to conceive, I had to, and I have to still today, ask them to reduce a lot of weight. And reducing weight means like reducing weight in stones on like at the weighing scale, or losing the fat in thickness, like the amount of inches from their back and amount of fat from their love handles and their back and the shoulder and thighs and everywhere. Because as a doctor and as a physician, we know that the correlation between the infertility or subfertility in both men and women is directly reciprocal to your fertility index is directly reciprocal to your weight. The more weight you gain, the less fertile you will be, and the less fat on your body, the more fertility you will have in your sperms and more fertile eggs you will have in your ovaries. So as a gynecologist, my experience with fat reduction, it goes way back than today. As an esthetician in my clinic, but when I started the clinic, I was like astonished with the number of crowds and people showing up daily asking me solutions for the fat. Not only for aesthetic or beauty reasons, or some chiseled jawline, or a neck very smart and fine, or somebody who wants to have a beautiful selfie or photo, not at all. But the number of clients presenting these days are more and more here because they were referred by some other doctor, and the doctor was very concerned about their knee surgery or their ankle surgery or their spine surgery, or kind of surgeries which are very dangerous. These clients are usually more than 40, around 45, in a bracket of 45 to 60, and they are at verge of at the plan of some massive big surgery which their doctors doesn't want them to go under the knife, because they are suffering from many other ailments like diabetes or blood pressure or high cholesterol or some kind of a kidney disease, and they don't think that they are fit for anesthesia or general anesthesia or GA, and they don't consider that these clients should be taken on the operative table for 6 to 7 hours or 7 to 12 hours. So this topic of fat or weight gain or obesity has taken a very serious face in my clinic on daily basis, and I have to take it very seriously. So once I started my clinic, I had then started this whole research about the current and old modalities of fat loss, that what are available, and number two, that which modality is the best one for which client or which patient pool, and number four, what should I be doing best for my clients in my clinic, which is least invasive, which is most effective, which is most economical, which is very safe without risk factors, and which doesn't harm the fertility index of any of my clients, either male or female. And then eventually I started my research. I started to research by talking to many other doctors. I started my this whole data collection at my own patients, trying these different modalities on different group of people in my friend circle, on me myself and my family members and my patients, and taking their due consent for this particular topic that we are trying to reach a proper conclusion. So what are the modalities available these days in our modern era of 21st century? I think number one, which has been around for a very long time, is the liposuction. The most famous liposuction, or liposuction with or without tummy tuck or any skin stretching technique after liposuction to stretch out the lax tissue from where the fat was removed. Number two is the cryo freezing or cryo fat freezing. Number three is in the cryo freezing, what we do is this, that we actually numb the tissue of your tummy, and there is a machine which because I myself had quite a few sessions of cryo freezing, that's why I know it particularly, that they actually press your tissue in between two slabs of a cold freeze ice, and then the probe on the up top of your tummy, it actually sucks your muscle into it and keep it sucking and pushing and freezing. And that was actually a very traumatic experience for me. It left many bruises on my tummy, and I was not comfortable enough to take it more than 30 minutes, although the session was planned for 1 hour. Then I went back next week to complete my session, and after even taking that much pain, I never lost any inch. In spite of the fact that I was doing a good diet, a healthy diet plan, I was doing a bit of 30 minutes exercise, whatever I could have done, and I was taking whatever necessary boundaries or limitations I should have been doing while taking any fat dissolving plan. Number three is the cavitation therapy, which is quite in for last couple of years, and quite a few of my friends got it from many centers, and which whatever they told me and whatever I admired and the kind of experience we had with it, it showed me that it was not that much effective for a good amount of people on which I tried. Number four was in my research was slimming drips, which are quite in and quite the up thing these days, and everybody is very fond of slimming drips. I have seen a noticeable good change in people with slimming drips, not with 4 or 5, but with around 10 to 12 drips. When they take that much amount of sessions, 10 to 12 sessions, there is a very good glow and they become tone, because the amount of antioxidants and amount of anti-aging ingredients in these drips, they make you really beautiful, and you get a very nice effect on weight loss, but not very remarkable. It is better, it is good, it is, but it is not something very economical and not something very effective. And the downside of it was like this, that the clients who lost their weight by slimming drips, they actually had wrinkles on tummy and thighs, or their love handles, or their buttocks, because, and their underarm in this area, in their shoulders. So because when they lose fat from the skin was lax and it was hanging down, causing wrinkles on the upper surface of the skin, or the skeletal muscle of the skin. Number 5 is the solution, which is called fat dissolving injections, and I tried it on quite a lot of people, including me myself. And I just had a baby, a year ago, and losing weight after a C-section is not very easy. And although I tried it on my tummy, and I have seen very significant, very reasonable, good amount of inches lost on my tummy, and I find them very safe. There is no entry wound like a liposuction, like in liposuction. There is no exit wound. There is no chance of infection. There is no pre-anesthesia or pre-surgical assessment of the client. There is no need for hospital stay. It is quite economical. You don't need to tell everybody that you are getting these injections, or you're trying to get rid of the stubborn fat which is making you unhealthy and giving you a lot of diseases which you don't want to carry around. So in my own particular perspective, I have finally reached to this conclusion for now, for this month of September 2022. I am sure that there are a lot of new products, there are a lot of new modalities in pipeline these days to target the obesity, which is showing itself like a tsunami all around the world. And insurance companies and hospitals and everybody is under so much strain and pressure of extra fat, extra weight, infertility, polycystic ovarian syndrome, male infertility, and you name it, and all the diseases are because of this fat. And imbalance of hormones, the basic structure of a hormone, it comes from the fat. So whatever you do, wherever you go, you cannot deny this particular fact, that the main load of diseases these days on the medical science or hospitals is because of extra fat, and the patients carrying the fat are a source of major diseases in hospitals these days. So far, till today, my personal opinion is this, that my client satisfaction from my clinic is very high, because the clients, they don't feel that anything was interfered or anything stopped, or somebody stopped their regular life or daily life. Their kids were going school, the food was being cooked by them, they were driving, everything was regular, normal. They just came into my clinic for 1 hour. We had a numbing cream on their tummy or legs or whatever, and then they had these small injections, and they went back, and they came back to me after like 6 to 8 weeks, and they had lost, like some few people have lost like 10 to 11 inches in 2 sessions or 1 session, and few people have lost like 5 to 7 inches, depending on whatever they are eating at home, what care they are taking at home, and how healthy they are eating. So we don't stop you from eating anything, not even we don't ask you to have some particular kind of diet. We just ask you to eat healthy, to have raw fruits and vegetables, to have less bakery, less fizzy drinks, less juices, and try to eat early. The big meal of the day should be taken from 4 to 6 in the evening. It should not be eaten around 8 to 11 in the night, and then you go to bed on 1 or 12 midnight. The time frame of eating the big meal of the day, which includes some rice or chapati with some salan, it should be taken around between 4 p.m. to 6 p.m. That is the ideal time. And in the morning you can have oatmeal or boiled egg or some omelette in olive oil or desi ghee or butter, whatever you like, without bread. You can use a lot of stevia for making your sweet dishes, to have some oatmeal, to have some porridge or whatever you like, or some shakes or smoothies. So you can have chicken salads, you can have tikka or some kind of meal, whatever you can make for yourself, any dosa with some filling or any kind of stuff, spring rolls or chicken barbecue or whatever you like, any kind of kebab or whatever you want to have. But the main concern is always this, that you have to have 3 to 4 small meals in a day, a good portion of fruits and salads, good portion of oats and olives and olive oil with black coffee or green tea. So there is no particular frame of we are not giving you a set plan to eat like on a schedule. This is an open diet. You can have roti of multigrain atta, a small roti like of the size of a saucer. You can have that kind of a roti with a calculated portion of salan, not big portions. And try to have some appetizers before the meal, like 2 glasses of water or some cucumber salad or olive oil salad or some kind of fruit to reduce your amount and portion of your main meal. And avoid bakery products, avoid burgers and foods from outside, specifically foods with a lot of white flour and a lot of cheese and mayonnaise and fizzy drinks and chips and fried products. So I think all this discussion, I have summarized it like there is no particular diet, there is no big risk factor to your fertility or your sperms or to your eggs. There are no risk factors to your any other system. The only thing you need to have a good quality product of fat dissolving injection. The product should be of very good quality, and the professional handler of the product who is giving you or deciding dose for you, that person should be a very well trained doctor and a professional person who can understand that this product and this drug is designed to be metabolized in liver and to be excreted out through your kidney and through your urine and stool. So the professional doctor, what they will do is this, that they will get your tests done, they will keep you under watch, and they will divide your doses in a way that they will never hurt any your organ, and you will have all the benefits of the product. Although nothing is unsafe until used improperly. Even the salt and the sugar, they are not unsafe. If they are used in a wrong proportion, they will, destroy the whole food. They will destroy the whole taste of the dish you were cooking. So in the same way, when the product is properly handled, it is properly calculated according to your BMI, and you are under the supervision of a very well-trained professional person or doctor, and the product is of a very good and high quality, and the professional person is not at all compromising on the quality of the product, because there are so many Chinese products in the market available which are obviously not of the same quality as an Italian or a French product. So these were the factors. I would like to summarize this particular topic right now, that for me this product is a revolution. Right now I do have oral lipolytic tablets in my clinic available, and these tablets can be prescribed under my supervision with a professional overlook on your case. And that is the 6th option which I use with the fat dissolving injection. When you come to my clinic, I have this particular notion of giving you solution with the least amount of surgical intervention and most economical and most safe solutions. So now I summarize that out of liposuction, cavitation therapy, cryofreezing, warm laser, slimming drips, or any other way of losing fat, gym or anything else, they are also on the line. I personally feel that fat dissolving injection is the most safest product for our women. It is cost friendly, it is economical, and everything I have told you already about the product. And when I use it with the lipolytic oral medication, the effect becomes 100 folds better. So I would now summarize this particular topic on this note that either you are a candidate for the fat dissolving injection or you are not a candidate. That will be decided in my clinic when you will visit me, and you can contact with my team for first free consultation. So I can check your history, examination, your medical test, and I will decide for you that how we will go around to give you a very slimmer and toned body, along with giving you a very good lifestyle so you can be empowered. I actually don't want you to be kind of addictive to this kind of injections or medicines. I want you to change your lifestyle with me. I am here to support you and strengthen you and give you the motivation to walk this dark path from being very fat to very fit. Although I am like you, I am trying my level best to be better every day, and at times there are a lot of people who keep on saying that once you gain fat, you are obese, you are never the same person. And that's true, because we as the people who have gained weight after pregnancy, and we have beautiful babies and we adore them so much, and we have beautiful families, we need support. We need support from each other to walk this path to have a better life. And I really discourage all my patients to be addictive of these injections or to come back to me again to take injections. I really encourage you to have a better lifestyle, to cook for yourself, to make better meals. And I'm going to start a cooking channel, a diet healthy meal channel, where I will show you all my recipes for healthy salads to healthy biryanis to healthy sandwiches, which you can enjoy at your home, and you can cherish yourself, you can enjoy your life, and you can have a good healthy body. These injections will be given to you only to get rid of the stubborn fat pads which you gained during pregnancy, or which you gained during the time of ignorance when you were suffering from polycystic ovarian syndrome and you never knew that why you are gaining so much resistant weight and it's not getting you anywhere, in spite of the fact you're going to gym, you're hiring a trainer, you're talking to a nutritionist, you are following all the diet plans, and yet you are gaining so much weight. So here we come with the solution that we will help you to get rid of your stubborn fat pad. Along with that, I will love to give you a new lifestyle and a new perspective of hope, happiness and sunshine at your life, not to look at life with depression and hopelessness, which a lot of obese people do develop because the hormonal imbalance shift their brain to depression. So I think today it was an ample talk. I gave you enough information to understand the collateral analysis among all the modalities available in the market and my particular consensus about it. I personally feel that there are a lot of people out there who are practicing as an esthetician, and they must have their own perspective and their own way of fighting the fat war. I call it a fat war, and fighting the fat out of the people. So I personally accept that many people can say that my opinion is not right, but as a physician, as a doctor, as an infertility specialist, as a person, as a gynecologist who has been trying to make all my clients to lose weight since last 15 years almost, I reserve my right to have an opinion, and that opinion is there which I gave right now. And if somebody else has their opinion, I totally respect that, and I totally thrilled to listen new ideas and their way of handling the fat. And I will love you to share your way of handling the fat war and what you have learned, because fat is a domain which has become an enigma and a problem, a puzzle for everybody, and all of us are learning from each other all the time. So please keep sharing your views, keep sending your messages in our inbox, keep telling us to make more videos about the topics you want to listen, and I hope that whatever knowledge I have, I was a good communicator to give it all to you. I think it is my own duty as a doctor to give away all the knowledge I have before I die away from this world. And someday somebody will be watching these videos and they might think that that was a good amount of knowledge. So goodbye for now. See you again. If you have any questions, feel free to leave in comment section or send me the messages. I will love to answer them in upcoming videos. Thank you very much. Stay blessed. Take care of your family. Take care of all your loved ones, and never take anything for granted around you. Thank you very much.